St. Augustine's Hospital in Berea, that's a suburb of Durban, eThekwini, has been shut down after 47 staff members tested positive for the coronavirus.
We also know 4 people have died from the virus at the hospital. To give us an update on the status and what's happening there at the moment, we're chatting to Dr. Richard Friedland. He's the CEO of the Netcare Group. Dr. Friedland, a very good morning to you and thanks for your time. Understandably, a very busy, trying time for you at the moment. Now, let's just get straight to it. And you are aware that there are accusations coming from your nursing staff and unions as well that you did not act speedily enough and well enough and quickly enough at the time of discovering your first case. So take us back to when you discovered your first COVID-19 case in your facility and what measures you took at that point.
Thank you, Dan and Uveka, and absolutely. So let me just explain the process that we have in our hospitals, if I may, because I think that will give our listeners a perspective on what we're doing. We screen everyone coming into our hospitals. We were the first to introduce that screening way back when this happened in January. And we divide up our patients into high-risk patients, those that would go into a red zone in the hospital, in other words, with known signs and symptoms of corona, such as a cold, fever, a cough, etc. And then we also have patients that are in an orange zone in our hospital. In other words, we think they may have coronavirus or COVID, but we are still awaiting their tests. And then we have patients that are in our green zone, which are coming in for emergencies, etc. The 2 patients that this transpired in had originally come in with no known travel history or any signs or symptoms of coronavirus. And as soon as we picked that up, in consultation with the National Institute of Communicable Diseases and also the local Department of Health in KwaZulu-Natal, we immediately screened and self-isolated the 30 nurses that were in close contact. This was the advice of the National Institute of Communicable Diseases and the Department of Health. And we immediately screened those nurses and we put them into quarantine. So I think we acted as fast as we could under the circumstances. I think if I may say the following, this is an unprecedented situation for us globally as healthcare workers. We've seen over 1.5 million people being affected by this virus and over 88,000 deaths. And what we've seen in our hospital, unfortunately, is what has happened in hospitals in Italy and France and China. We've put in an enormous amount of precautions to try to prevent this. And on a daily basis, we're increasing that as we learn more about this virus and how virulent it is.
Dr. Friedland, thanks for explaining your procedures since January. Dan Moyane here. Now, if you were screening since January and then categorizing the different patients into red, orange, and green zones, where could you have failed this time, where 2 people were then tested with positive COVID-19, had no travel history, and then you began to isolate 30 nurses? From what we're hearing, it didn't really seem to have helped you. Where do you think you failed?
I think that's an excellent question, Dan, and it's for that reason Professor Salim Karim, who's an advisor to the Minister, and his team of epidemiologists and infectious disease specialists from the University of KwaZulu-Natal are assisting us at the moment in trying to determine how this transpired. Because if a COVID patient had come in, they would have been in a separate cubicle in our emergency department and wouldn't necessarily have come into contact with a patient coming in for another emergency. And it's possible it occurred there, but again, I am speculating, and I would just ask us that we just allow them to do their investigation, and I think we'll be able to get to the bottom of it, and we'll certainly share in a completely transparent way the outcome. I think there will be important lessons for us at St. Augustine's, but also across our network of hospitals and probably for other hospitals in South Africa.
Dr. Friedland, just to go back to the point where you say, yes, you had identified the nurses who had come into contact, they were placed in isolation. Just clarify for us at that point, would you say then that the rest of your staff, or all of the staff, that you had the proper PPE, that you had the proper protective gear for them, all those measures were taken in terms of hygiene and sanitizing the hospital around that time, even while you were waiting for those test results and all of that to come back? Would you say everything everything possible was done then to prevent the spread back at that time?
Rebecca, that's also an excellent question, and we've been, evaluating that very, very carefully. So we've never not provided adequate PPE. In fact, our mask policy is much more stringent than that of the National Institute of Communicable Diseases and that of the World Health Organization, is that we're asking every single person in our hospital to wear a mask. Now, ordinarily, that wouldn't apply to admin or contract staff or nurses that aren't nursing patients at risk. We have now put that policy in place. I think at the time, in our green zone of ordinary ward patients, we certainly didn't have that mask policy in place. We've now put that in place, but then ordinarily we wouldn't have expected those patients to be COVID positive. What we've also done is in our green zones, we're also insisting that all of our nurses and staff that deal with patients wear gloves, an apron, a mask, and we've also issued visors, some 20,000 visors across our group to make sure that everyone is also wearing a visor. So, in the green zones, we had a normal policy. We had a very heightened PPE policy in our orange and red zones. We've now upped that policy in our green zones to make sure there's no inadvertent spread in a patient that we wouldn't ordinarily expect to be positive.
Now, Dr. Friedland, sorry, just from far, one has heard voices from the healthcare workers, some of the nurses there. We've seen unions like DINOSA expressing their dissatisfaction. Did the nurses, did the healthcare workers at the time understand that distinction that you are making, that at that time in the green zones you didn't provide protective things because you assumed everybody was safe there? Did they know that distinction very well? Was it clear to them?
Whenever a nurse works with a patient, we expect them to have adequate PPE. I'm talking about admin staff and nurses that wouldn't be exposed to patients. But the most important issue, Dan and Uveka, is proper hand hygiene and social distancing. We can have all the PPE in the world, and we've spent 300 million rand on buying PPE at some exorbitant prices, I'm afraid. But hand hygiene is absolutely critical, and so is proper social distancing. And I think these are other elements that we're looking at within our hospitals to try and force that we do that as well. And it applies to each and every one of us in our homes, even though we're self-isolating or wherever we're going, is proper hand hygiene. So I think I can say categorically we've always had enough PPE in our hospitals. There hasn't been a shortage. I understand the fear and concern of unions and people out there, but we have never stinted on providing protective equipment.
Dr. Friedland, there is a perception out there coming from KZN. Myself, I have family, I have friends who are in the business, who work in the industry as well. There is a perception out there that Netcare hospitals, some of them have even worked at St. Augustine, saying, yes, even if you are sick, you are forced to come to work. Can you say, are you confident that in this time of this outbreak, that was not what was happening there as well, that nurses or staff who were sick were being asked to come to work regardless?
Absolutely, Rebecca, and that's the entire purpose of our screening. Let me go into that in some detail, if I may. So what we instituted from the 15th of January was screening outside our hospitals to ensure that no one came into our hospitals that either had a travel history, and at the time of these patients we were focused on international travel, that no one came into our hospitals who had any signs of either a fever above 38 degrees or a lethargy or a headache or a sore throat or coughing, and importantly, no one came into our hospitals who had been in contact. And obviously, we rely on the broader public and our staff, and this applies to doctors, to nurses, and to contractors that would come into our hospital, and we rely on them to self-declare properly. The last thing we'd want is someone coming to work who was ill.
Okay, Dr. Friedland, fine, the investigation is underway, as you've told us. We'll have to await and see what it finds. But just now we're reporting that the hospital has been shut down. I just got two more questions. The impact of shutting it down on staff we're supposed to go to. Will Netcare still be paying them their salaries, for example, or a portion of their salaries? And very importantly, what are you aware are the efforts being done to trace the people who may have come into contact with the COVID-19 positive staff?
Okay, so to answer your first question, Dan, we are not just paying a portion of the salary to our staff. We pay them their full salary, and that applies to every Netcare employee, whether they are self-isolating at home, whether they're not working, or whether whatever they're doing. So I want to make that abundantly clear. No one is being disadvantaged during this lockdown period, and no one is being disadvantaged because the hospital was effectively shut down last week on Thursday night. I want to make that very clear. The second point is we're also assisting all of our healthcare workers to check whether they can safely self-isolate given their own personal circumstances. Some of them live in more challenged circumstances, and they can't necessarily self-isolate properly. And so of the amount of staff, we have some 13 staff members who we're accommodating free of charge, and we've got that offer out to all staff members across all of Netcare. The second issue is that we have a 24-hour line that we've established and an SMS line, and we are contacting every single nurse on a daily basis to check on how they are and if there's any symptoms and whether they need to come in for testing and treatment, and we will pay for all of that. And secondly, we are also reaching out to all patients who were in the hospital over the last month. That's from the 1st of March, even though the first COVID patient, I think, was only on the 13th or 14th of the month. We are reaching out to each and every one of them to check up on them, and if there's anyone that's showing any signs or symptoms of COVID, we're offering to test them at our expense and to treat them. So I think we're doing everything we can, and I want to reassure the community around St. Augustine's and in KwaZulu-Natal that we'll do everything in our power to keep our staff and our doctors and also our patients safe.
All right, Dr. Friedland, just one last question. We understand that the facility has been closed to new admissions now. You are shut down at the moment. Just clarify for us what's happening to existing patients, that they are being moved to other facilities and the precautions around them at the moment.
So to date, we haven't moved any patients to other facilities. We await that instruction from the Department of Health. But we're acting on the advice of Professor Karim, which has said that we shouldn't move patients. And obviously, we are always strictly following the guidance of the Department of Health and also the NICD, and we'll be guided to them as to whether they want us to transfer patients or not. But at this stage, we haven't transferred anyone.
Dr. Friedland, thank you very much for your time. We'll have to await the investigation by Professor Karim there.